Hi, and welcome to Parkinson's disease education. Today's video is going to cover potential treatments for dystonia and dyskinesia in Parkinson's disease. Stay tuned, buckle your seatbelts, and let's roll. Alright, so in last week's video we discussed the differences between dystonia and dyskinesia and their causes when it comes to Parkinson's disease. I'm going to link that video up here so you can watch that, and then if you need to, and come back to rewatch this video for the context of what we're discussing, which is treatment options for those conditions. First of all, let's discuss dystonia and potential treatment options for that. A fun drinking game to play might be how many times I say the word potential in this video. We'll see who's under the table by the time we're done. I'm going to try to keep this to 5 minutes or less, so here we go. First, let's discuss the least invasive options when it comes to dystonia. So first of all, one option could be Botox or botulinum toxin injections. Those could provide relief for anywhere from weeks to months, especially if dystonia is a persistent issue for you. Another option might be medications such as, let's say, baclofen that are kind of antispasmodics. That could be something as well that could help with dystonia and reducing those painful muscle contractions. The most invasive option, but certainly could be a viable option for you if you're a good candidate, is deep brain stimulation. So a DBS implantation could be the answer for potentially a lot of motor symptoms and non-motor symptoms. I personally have a client that had DBS back in 2015, and the dystonia was greatly improved and reduced by that, practically eliminated in fact. He was off medication for a temporary period of time until, of course, the levodopa had to be slowly introduced back in to manage the symptoms. But the DBS went a long way towards eliminating or greatly reducing that problem. Now, determining candidacy for deep brain stimulation is an extensive process. However, it could be well worth it for you if you're a good candidate and something that could be a long-term solution down the road. And finally, and I should have mentioned this with the non-invasive, but physical therapy is another option. Dystonia typically is a result of a reduction in dopamine or during a wearing off period. That's one time it could happen is when you're wearing off of dopamine. So exercise, especially intense exercises such as those found in power moves or LSBT big, even rock steady boxing, things like that, can actually increase the levels of dopamine that your brain is producing. You're using other areas of the brain, other basal ganglia cells in the brain besides the area that Parkinson's affects, and those cells still work and can produce dopamine. So exercise and physical therapy particularly is a good option for you as well, potentially to improve dystonia. There's that word again. So next we'll talk about dyskinesia. So dyskinesia, as you may recall from the other video, tends to happen when doses of levels of dopamine or doses of dopamine are at their peak. So as you can imagine, when you're at your best movement capability, your dystonia is most likely going to be the worst. So for many, a gradual weaning down or reduction in dosage of dopamine may be an option. Titrating down the dose of carbidopa levodopa or a dopamine agonist, if that's what you're taking, may result in improvements in the dyskinesia. It's a very delicate balance to obtain because, as you well know, if you decrease dopamine too much, you may have increased bradykinesia, rigidity, and so forth, even though the dyskinesia might be better. Whereas if you have the higher levels of dopamine, the dyskinesia could come back and rear its ugly head again. So it's kind of a catch-22 in some ways. But it could be worth it if that's the case. But in the case of my client who has had DBS in 2015, even though he was off medication for a while, he's now back on dopamine or levodopa of some kind every 2 hours. And so reduction in dopamine is probably not an option for him or somebody like him. Another option out there, though, is a different medication that could be added. One drug is amantadine, and that has been shown to improve symptoms of dyskinesia and reduce those annoying repetitive movements. Also, there are some folks that may benefit from the long-acting form of amantadine, and that's called GoCovery, which was just released a few years ago. Talk to your movement disorder specialist or neurologist about potential medical intervention on this, as medication may be necessary for one or both of these conditions we're talking about today to manage the symptoms. I hope you've enjoyed this video today and gotten something positive out of it in terms of hope for improvement, or at least a direction to go to look for improvement in these conditions. Let me know in the comments below, like this video, and please share it with others. And if you're enjoying this material that we're doing on the channel, I'd love for you to subscribe and support the channel in any way that you can. I appreciate each and every one of you for watching. As always, be empowered. I'll catch you in the next video.